I am closing the door to provide privacy for the patient. I am now washing my hands for 20 seconds, and then I'm going to be putting my gloves on and my mask. My name is Miranda. I'm going to be your student nurse for today. Can you tell me what brought you in?
General checkup.
General checkup. Great. I'm going to ask you a few general questions about yourself, and then I'm going to do a more thorough assessment pertaining to your heart, your circulatory system, your breasts, and as well as your lungs. Is that okay?
Yeah.
Awesome. So just ask a few general questions. Can you tell me how old you are?
22.
22. What is your name?
Devin.
Can you tell me what sex you identify as?
Male.
Yeah. Just quick question. Do you know what year it is right now?
2021.
Okay. And then do you know what state you're currently in?
Michigan.
Okay. Great. How tall are you?
5'6".
And how much do you weigh?
143.
143. Okay. So doing a little bit of calculation here, that gives you a BMI or body mass index of 23.1, which is considered to be normal. So that's great. So now I'm going to ask you a couple more questions that are a little more specific. Is that okay?
Yeah.
Great. So have you had any recent chest pain?
No.
Any difficulty breathing?
No.
Have you had any heart surgeries before, whether that was when you were younger that you're aware of or any recent?
No.
Okay. Do you have a current cough?
No.
No cough. Okay. Do you feel tired or fatigued?
No.
Okay. Have you noticed that your skin is a little bluish?
No.
Okay. And then have you noticed any swelling, whether that's in your hands or your feet or your legs or your arms?
No.
Okay, great. And then just real quick, have you ever been diagnosed with high blood pressure before?
No, I'm not.
Okay. Any heart disease that you're aware of?
No.
Okay. And then are you on any heart medications?
No, I'm not.
Okay. Great. So then we're going to ask a couple more questions that's pertaining to your circulatory. Do you notice any leg pain or cramps? Or
No.
do you ever experience that? No? Okay. Have you noticed that your skin changes in your arms and legs? This could be like discoloration or anything?
No.
No? Okay. Your lymph nodes seem to be good. I don't think they're enlarged. And are you on any current medications?
No, I'm not.
Okay. And then just to do a little quick assessment real quick, not assessment, but have you ever smoked tobacco, marijuana, or vaped before in your life?
No.
No? Okay. Okay, my next questions are going to kind of pertain more to the breasts. Do you experience any pain in your breast area?
No, I don't.
Have you noticed any lumps or felt tenderness?
No.
Have you noticed any nipple discharge?
No.
Okay. Any rashes around the area?
No.
Okay. And I do want to make you aware that men do have the possibility and they can have breast cancer. So these are a little more specific. Do you know if anyone in your family has ever been diagnosed with breast cancer?
No, I don't.
No? Okay. And then have you ever been demonstrated or shown the breast self-examination?
No. Yeah.
Okay, so just a quick one. You're just going to take your arm back, and then you're going to take your 3 fingers, and you're going to feel around in circular motions. You're going to feel for any lumps or bumps. If you do notice something that seems a bit abnormal, you're just going to call your provider and let them know and schedule your next appointment to have that checked out. And then just a recap for your lungs. You don't have a cough, correct?
No, man.
No cough, okay. And you don't have any difficulty breathing or chest pain?
No.
Okay. So, on that note, so the next thing I'm going to do is I'm going to do a more in-depth assessment on your thorax and your lungs. Is that okay?
Yeah, that's fine.
Okay. So the first thing that I'm going to do is I'm going to check your chest expansion. So if you want to just sit up a little bit for me. Thank you so much. And just breathe normally for me. Everything seems pretty good there. If you just want to do a quick turnaround for me so I can do your back. Awesome, thank you so much. Whenever you're ready, go ahead and breathe. Perfect. Grab my clipboard. So then the next thing I'm going to do is I'm just going to have you say the word blue moon. And then when you hear me say again, just say it again. Okay? Perfect. Go ahead.
Blue moon.
Go ahead.
Blue moon.
Mm-hmm.
Blue moon.
Mm-hmm.
Blue moon.
Perfect. You want to turn around for me? Great. Go ahead.
Blue moon.
Mm-hmm.
Blue moon.
Mm-hmm.
Blue moon.
Mm-hmm.
Blue moon.
And one more time.
Blue moon.
Perfect. Thank you so much. So the next thing I'm going to do, I'm going to percuss your back. So if you want to face forward. Yeah, no, you're good. You're just going to face forward. I'm just going to do a quick percussion. Make sure everything is good. Awesome. And then I'm going to listen to your breathing. At this moment, what I would have my patient do is have them remove their shirt, and then I would begin listening to their breath sound. So if you want to face me real quick. Thank you. We're going to use the diaphragm of the stethoscope. So just take deep breaths in and out for me. Great. Now I'm just going to listen to your back. You want to face forward for me. Do the same thing. Deep breaths in and out. Great. Everything sounds pretty normal. I don't hear any muffling sounds. I don't hear any crackles, which is good. So then the next thing I'm going to do is I'm going to be doing an inspection of your neck and your thoracic cavity, and as well as listening to your heart. So the first thing I'm going to do is just feel for your carotid artery, which is here. Make sure that we have a pulse. Awesome, awesome. And then I'm going to use my stethoscope here, and I'm going to listen to it and make sure that the pulse is good. I'm going to spin it, and I'm going to use the bell of the stethoscope. Awesome. So I can hear your pulse. Everything sounds good. So the next thing I'm going to do is I'm going to listen to your heart sounds. Super quick. You can use the bell. Awesome. Everything sounds pretty good. Just look here real quick. Alrighty, the last thing I'm going to do is I'm just going to check your pulses in your arms and your legs. Is that okay?
Yeah, that's fine.
Perfect. So the first one I'm going to check is your radial pulse, if you don't mind giving me your wrist. Thank you so much. Awesome. The next one I'm going to check is behind your knee. Just keep your leg relaxed. Thank you. Okay. The next one I'm going to check is on the ankle, on the posterior tibial. Perfect. And then I'm also going to check the top of your foot. Perfect. Everything seems really good. Everything looks great. Thank you for coming in. That's the end of assessment 2.